So my name's Simon. I'm a mental health nurse and family therapist, and I work with the Early Intervention Service. And my job is to really make sure that when people come to our service, they're offered a full range of support, and that includes support for carers. And we do that in many different ways. So one of the ways we do it is to provide information when someone comes to our service about what is psychosis and how does it impact on the person and how might it impact on them, and some practical advice on what might be helpful to help the person as such. People who come to our service will have many different relationships with the person accessing our service. So we know that we'll have concerned parents or husbands or wives. Sometimes people come with friends, for example. So our job is really to make sure that people get all of the support they need, not just the person accessing the service, but the whole network around them. What we know, I guess, from many studies over many years is that providing that package of care for not only the person but the family around them reduces things like relapse rates, for example. It minimises stress and reduces time in hospitals. So that, alongside other things we do, including other interventions like medication, kind of really optimises the person's recovery journey. So we know when someone becomes unwell in a family, it can have an impact on other family members as well. And one of the examples I like to use is if somebody for example, breaks a leg, they might have to have time off a job, or they might have to be out of school for a time, and anybody else around them might have to change their role a little bit in terms of caring for that person. They have to make adjustments too, which can cause stress. And I think the thing is, that's the same, if somebody becomes unwell with someone like psychosis, they might not be in employment for a certain amount of time, and others might come in to have to change their roles from being employed to being a bit more of a carer. And of course, sometimes all of these things create an environment of stress for families, for example. And what we know is that when stress comes into families, sometimes people don't always communicate in the way that they would normally do. What we like to really do is to sit alongside families and think about how we can support them to reduce the amounts of stress where we possibly and practically can. Sometimes that will be making sure that we do very pragmatic things, like working with employers, for example, giving information to families, and also thinking about some of the adjustments that they're going through, having to deal with something, like we said, that's very, very new and unknown. And we know that sometimes that some of the skills we might inform our work to help families is just thinking about communication skills, for example. So we like to think with families together about how that communication can be better. What we do know is that most families who do engage in this process actually have a positive experience, and quite often they find that things are better longer term, less hospitalisation, reduced risk of relapse, and better recovery rates, which is what we're working towards. When people come to our service, we know that quite often they'll have no knowledge of psychosis, or a limited knowledge, so we give them a pack which has information for carers in there, as well as how to access a carer's assessment. One of the things we do is run an online group roughly every 3 months, where people can just attend, and we have some people talking about what is psychosis, maybe a bit about medication, a bit about what to expect from an early intervention service. And we found that's been really, really helpful just to make people feel more supported as they come into the service. What we do after that, if people want, we have a few modules where people can come specifically to ask questions and listen to people talk about medication, for example, and that will be talked about by the psychiatrist. We might talk about some of the psychological interventions and for example, family work. I might talk about family work and what that is. On the carers support pathway as well, people can come to have a cup of tea, drop into our local hall once a month, where they can just get together and just talk about some of their worries and hear from others, and hear, and some support from us on how they've kind of managed that. So we run that for our carers. That's what we do. So I think if people are interested in thinking together about problems as a family, I would always say ask to speak to their care coordinator and just have a sit down and talk to somebody who delivers further support for families, who can then speak a little bit more about what the interventions are, what they mean, and how they can access that, and that's really important. So we always say that the care coordinator is the glue that holds it all together, and the person they should go to first to get more information.